The last question is it possible to keep any kind of collaborative spirit between the two of you as parents and protect the shared safety of your children, even in the face of addiction and illness? So I wanted to give a couple of examples that I consider success stories to see if that would be helpful to people. I had two parents come and consult me because they were getting separated and divorced, and Dad had bipolar illness. And it was acknowledged, he was under good care for it, and they had spoken about it a lot, but the kids were still pretty young. And the mom's fear was, what if he starts to go into a manic phase and I'm not there, right? On the one hand, she wanted the kids to be able to spend overnight time with their dad and have a great relationship with him, but she also had this very, protective instinct about, I won't be there if he starts to go into the manic phase, right? So we kind of went back and forth with that a little bit, and we worked out something where we said that he agreed that he would give his treating physician, his treating psychiatrist, the permission to pierce the privilege, the confidentiality of their treatment relationship, not for purposes of everything, but only if he was starting to go into a manic phase, that he gave his therapist permission to call what would be his ex-wife and say, this is a time where you have to hold back on the kids going to Dad's overnight, which was just such a wonderful, it really solved the problem, and it certainly took the pressure off the psychiatrist who, didn't have to kind of make that judgment call. Is this really threatening? What do I do? It was very explicitly done, and the psychiatrist brought into that kind of conversation, and they did just a really, really elegant, mutually respectful job that enabled the kids to continue a good relationship with both parents. The second example I want to give was a mom who struggled with alcoholism, and they had a very young child at the time. And there was a lot of fear about what would happen if she started drinking, because the child was really preschool age. And as we could all understand, that could be very risky, right? So in that case, they happened to have been a fairly privileged family that could afford full-time help. And what we worked out was that she was going to agree to random drug screening and put into their agreement that if she did test positive, that she would not have any alone time with the child for 120 days after that positive test, but the nanny would be there full time. So it wouldn't be like they're exchanging the kid in a police station or having some kind of strange, frightening, supervised visitation setting, but she agreed and signed the fact that the nanny would be there full time. She would not have any alone time with the child and any overnight time alone with the child if she had tested positive, until she had 120 days out that were clean, and she would continue to get this randomized testing. So I consider those both two really successful examples of how people navigated an acknowledged condition in the face of moving apart.